Have changes to your abs during or after pregnancy caused pain or kept you from living the life that you love? Or have you noticed changes to your abs and are looking for ways to prevent progression of a diastasis rectus abdominis? I'm Alex, and I'm a PT passionate about women's health. So today I'm going to discuss with you how to screen for a diastasis and how you can use that information that you find today to improve your relationship with your abs and with your mom bod. So many women have questions related to diastasis and to their abdominals. So for a little bit of background, we all have connective tissue called our linea alba. This connective tissue connects the two sides of your six-pack and your abdominals. It's typical that we have some distance between the two sides of our abdominals, but for screening purposes, a distance of more than 2 finger widths is considered a positive screen for diastasis. Now, I'm not a fan of fear-mongering. There is a wide range of normal in what's considered functional for women. So a woman with a 3-finger gap, that might be functional for her. Some of it's going to depend on how wide the distance was prior to pregnancy. I too had changes to my abs during pregnancy, as do many and maybe even all women. So if we look at some research studies, all of the pregnant mothers in this study experienced diastasis at the end of their pregnancy. So no wonder this is a common question. So assuming that you're actually having pain or difficulty due to your diastasis, there are 2 other things that I consider. And those are, 1, are you able to generate tension in the gap between your abdominals, or does it feel soft? And then 2, what issues is this causing you? So I'm typically looking for signs of how your abdominals are transferring load during painful or difficult activities. And that can tell me a lot more than just the screen itself. Okay, so let's go ahead and go over a quick assessment. A quick note before we start this assessment: if you're having pain or discomfort with this, always check in with your provider. You want to check in with your provider before doing the screen to make sure that you are cleared to lay on your back, to perform a curl up motion, and also to apply pressure to your abdomen. So as I said before, I'm not a fan of inducing unnecessary fear, but rather replacing that fear with knowledge. In some studies, it can take up to 6 months for diastasis to resolve after giving birth. Let that sink in for a minute. So while you might use this to monitor your abdominals after, say, your 6-week visit with your OBGYN, they can screen you too. Don't be discouraged if you have a positive screen. So as I stated earlier, how you feel is more important, and it's important that we allow your body time to heal and recover. There are some things that we can be doing during that 6-month time period as well. So I'm going to hop off my soapbox and we're going to jump straight into the test. You're going to bend your knees up and keep your feet flat on the floor. So I'll pull my shirt up so you can see my abdominals. Lie on your back with your knees bent, feet flat on the floor. Take your fingers and place them parallel to your abdominals in the space between your abdominals. You can focus on assessing at the area that you notice the widest distance. Today, I'm going to demonstrate just above your belly button. Curl your head and shoulders off the surface and use your fingers to assess the distance between your 2 six-pack muscles. Also note if your fingers sink in or if there's tension below your fingers. If you are wanting to assess this at a few locations, you could also check halfway between your breastbone and your belly button, and halfway between your belly button and your pubic bone. If you notice that your linea alba region is very squishy, or that you're having doming, You can try adding an exhale as you curl up and see if that adds any tension. So here's an example for you. This can be an easy cue for some people to start improving their tension. If you're having any trouble, Women's Health PT can help develop a specific program to help you generate appropriate tension to reduce your symptoms and improve your condition. When I assess people, as I mentioned earlier, I look at how their abdominals are working in positions that they're having pain or difficulty. So let's say you're having difficulty getting out of bed or getting up off the floor, especially later in pregnancy. I would check to see if you're getting doming with these activities. So you can even ask your partner to check to see if you're having doming or basically pushing out of the linea alba or even maybe sinking in while you're doing these activities. So my goal is usually to see if there are any cues that we can incorporate with the exercise and with activities to reduce this doming. So we may have to modify an activity as you work on changing your movement pattern and generating that tension. So for my example from the screening, it may start with using an exhale, or it could involve something like looking at the relationship between your posture and your diastasis. So I've covered posture that can help foster an appropriate tension relationship in your abdominals and other diastasis related topics in the past. So if you're looking for more tips on addressing your diastasis and getting back to the things that you enjoy in life, check the link below in the YouTube video. And then if you did stumble upon this video without going through our newsletter and would like to subscribe to more videos like this, go ahead and follow the link below and subscribe to our newsletter. In our future newsletters, we'll cover helpful cues for generating balanced abdominal tension, so stay tuned for that. And if you're interested in getting the material before November, send me an email letting me know what specific topic you're interested in hearing about, and I'll do my best to cover the most requested material. So thank you guys so much for joining me today, and just remember that a healthy mama is key to healthy babes.